Hey, come on in. You're here for your 3 o'clock checkup? Okay. Take a seat. How are you today? Hanging in there. Okay, good. All right. Let me just look over my notes from the administrative assistant. And can you verify your name? Date of birth? Good. All right, let's see. So you're having itchiness of scalp. Okay. Little joint pain. Is there anything else that has been bothering you lately? Okay. Some indigestion, right? Okay. I'm going to give you a head to toe checkup so we can just, figure out some ways to relieve those symptoms, maybe figure out what's causing some of these things. Okay. All right, we're going to start. Let's take your temperature. All right, open up. Close your mouth. Okay. All right, looks good. I'd like to check your oxygen level and your pulse rate. So I like to tell everyone just take a few deep breaths. Get a nice resting heart rate, pulse rate. So gonna just read it right off there. All right, can you just let me slide this on your finger if you can put your hand out. There we go. That's right, feet flat on the floor. Just breathe easily. Good. Okay. Pulse rate is looking pretty good. But let me see, 82. Oxygen level 98. Excellent. Okay. I'm going to do all the vitals. Blood pressure next. And also check out your heart with the stethoscope, of course. All right. So if you can just hold out, which arm do you prefer, right or left? Okay. All right, we're going to put this around your arm. Just like this. Here, okay, ready. All right, just again breathe normally, easily. I'll loosen in just a minute. There we go. Okay. Good blood pressure. That's excellent. All right. All right. I'm going to put this on your chest, okay? Just breathe normally for now, okay? Just. I'm going to put it on your back and just take some deep breaths, okay? Breathe in. Deep breath. Good job. Over here. Another deep breath in. Good, good. One more. We'll get on this side. Deep breath in. Okay. Excellent. Yep. Your heart is sounding good. Your lungs sound good as well. All right. Now, would you like to opt for the B12 shot for just a nice natural energy boost? Okay. All right. Which side do you want this shot on? Okay, on this side. All right. Let me just. Where is my antiseptic? Hold on one second. Okay. Got my antiseptic here. Around this spot on your upper arm. Okay. All right. Ready? Just take a deep breath. 1, 2, 3. One more dose. 1, 2, 3. Excellent. All right. Do you mind if I get close and touch around the joints on your face, the joints on your arms, and your knees and ankles? I also feel around your neck. I know you had some joint pain here, you said, and around the jaw, as well as the shoulders. Okay. All right, I'm going to get close and just palpate a bit, and we're going to check that out. Okay. All right, we're going to start here. Just going down and around. Down your arm. Other arm, okay. Okay. I'm going to just palpate along the collarbone. A little closer and just feel back of head, neck, and shoulders. I might even do a little massage just to get you a little relaxed so we can really see how your joints are moving, okay? Let's see. Right, just behind the nape of your neck, that area. Okay. Shoulders. Does any of that hurt so far? Okay. Alright, we can do a little palpating on your scalp as well. Roll you a little closer. Does any of that hurt? Any parts of your scalp, skull? Okay, good. Alright. I'm going to check your arm, your elbow joints. You said we're giving you some issues. Okay. Alright. You get... You're feeling a little warm to me, actually, so I'm going to check your temperature with this other machine. Hold still. Yeah, you have a little bit of a temperature, not too bad, okay? Alright, we're gonna check your eyes now with this little pen light. Let's see if I can, oh, there we go. It's a nice soft light, so it shouldn't bother your eyes. So first, look at my nose, and I'm just gonna move the light, but keep your eyes on my nose. Keep looking right here. Okay. Now I want you to keep your head still, but follow the light with your eyes, okay? Let me know when the light goes out of your vision. Good. 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 little bit closer. I'm going to open, get really close. Look at this eye, really close. A little bit of redness. Open, open. Good, good. Okay. This eye over here, open. Gonna get really close and check out pupillary reaction. Open, open, keep it open. Good, good. Okay. A little red, but allergies probably. Okay. Okay. Blink, blink a few times. I'm going to also then look into your nose, mouth, and ears. Okay. So let's tilt your head up a little. That's right. Good, good. All right. I'm going to look up this nostril. All right. And this nostril here. Good. Okay. And go, stick out your tongue. Good. Let me see. Yeah. A little tiny bit red, nothing to be worried about. Yeah. Allergies again. Okay. I'm going to check this ear over here. Let's see. All right. Yep. Palpate a little. Okay. All right, good. Just a little wax build-up here. That's all. Okay. I'm going to check this ear on this side. Just get a little closer. I'm going to palpate again, okay? Okay. All right, good, 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 good. Okay, let me see. Oh, let me just get that a little. Okay, okay, just a little wax build up here too, not too bad. Yeah, we can go ahead and clean that today if you want, okay? Okay. Alright, I'm going to go ahead and clean the wax out for now. Then we'll just check some of your reflexes. Just use this spray to loosen the wax. Okay. I'm going to just loosen it up with this Q-tip. Use these tweezers to pluck out the extra wax, okay? Okay. Hold still. Good, good. Okay, got it. Repeat on the other side. I'm going to loosen it with the Q-tip again. And then use the tweezers. See? Alright, and one more little bit. Almost got it. Almost got it. Okay. There we go. Good. I'm going to check your reflexes on your arms and knees, and we're going to also I have some magnesium spray for your joints, and I can massage that in. Magnesium is great for joint pain. But first I'm going to check the reflexes, okay? Let me see. Okay. Hold out your arm on this side, please. Okay. I'm going to hold your upper arm up with this hand and just hold the forearm loosey-goosey so I can check your elbow joint, okay? I got it, and good. Okay. I'm going to check down this arm, wrist. Same thing, I'm going to hold all your weight of this upper arm and you let the forearm go loose, okay? Okay, good. Gonna get down on either leg. Go down here. The knee. Let the knee just go loose so I can check that one, okay? Good. This side. Excellent. All right. We're going to do some magnesium spray on your elbows and a little bit on your neck and jaw. Right? Your neck, here. Elbow. It's infused with oil as well. This is the best way I'm going to massage this in to absorb magnesium into your system is through the skin. It's the best way to get the full effect. So I'm just massaging right here. The neck, back of neck and down the sides. Get a little more. I'm actually going to put a little on my hand. So I can really get the neck. And neck down to the shoulder tops. Okay, so I'll get your elbows. Work that a little bit. Excellent. Okay. All right, we are almost done with this visit. So we're also going to do a little lavender spray. I'm going to really target where you're getting TMJ. This can relax quite a bit. Okay. I'm going to also spray my hands. Just massage it in. Okay. If you could go open, close. Okay. Open, close. Okay, good. Keep it closed gently. Relax. Okay. Excellent. Alright, I want to check your temperature and oxygen levels one more time, okay? I have a different thermometer for the temperature just to check. I know you had a slight fever, just a very slight, so I'm gonna check. Okay. It's just a little bit high still. It's nothing to be worried about. I want to recheck your oxygen levels, okay? So if you could hold out the finger on this side, do the other one. Slide that on. There we go. Wait, just a little, okay. Take some nice, relaxed breaths. Okay, let me check. Yeah, interesting. Yeah, your pulse rate is a little higher, but also your oxygen levels are a little on the lower side. Nothing to be concerned about. I'm just going to give you a little bit of oxygen. Alright, so just breathe naturally. Good. How are you feeling after that? Okay. Good. You're getting a little more energy back from the B12 and the oxygen. Good. Okay. How are your joints feeling? Okay. A little better. Good. And I do want to prescribe you something for your scalp, which I checked out while I palpated. Okay. Let me just... If you could verify the number for your pharmacy. I'm just going to send them. And send. Good. Alright, that was sent over to your pharmacy. And you just want to rub it into your scalp. After you shampoo and clean and let it dry a little, you rub that in, let it sit overnight, okay? Alright. I hope you have a great rest of your day, and I'll see you at the next appointment, okay?